So glaucoma has a lot of challenges. Obviously, on the screening front, there's already AI that's pretty close to ready for prime time. It's being used in Australia in optometry clinics, and I'm sure many AI systems will come out that can just look at a photograph and determine high risk of glaucoma, which will be, I think, incredibly helpful because so many discs are concerning and it's always a difficult call. So something with high performance would really be a benefit to us. And we're starting to investigate some of that here at the Eye Institute. In addition, glaucoma patients need extended ongoing monitoring. And that's been the biggest challenge to virtual visits and how to do that. And what we are working towards, and I think should be implementing very shortly, is single location testing across our system where patients could get the testing they need and be monitored through remote care, the doctor able to zoom in and discuss the findings. Obviously, that would involve incorporating AI into helping the doctor make better decisions about what they're seeing. I also think that as we think about telehealth, we should be thinking more about what patients can do and never come to any clinic. And so there's no handheld take-home OCT device, unfortunately, but there are tablets, virtual reality approaches to testing side vision. And those will almost definitely be part of practice in the near term, would be my guess. And that's another area of research here at the Eye Institute.
So the eye exam is very much a visual exam, no pun intended, where we're looking at the eye in all of its aspects and trying to make a diagnosis based on what we see and what we find inside the eye. We also now have really amazing tools to help us with that, like fundus cameras and OCTs. Ultimately, with telemedicine at its height, when it comes to bear on ophthalmology in the future, it'll have all these tools at home for a patient to use or in their community at like a CVS. We're not there today. And so we're using things like Zoom and FaceTime to try to talk to patients. And obviously, you can't get the same quality eye exams you can as an in-person slit lamp or with your indirect ophthalmoscope or with all these tools. So we're not there yet. Ultimately, in order for an eye doctor to feel comfortable making a diagnosis from afar, you really need to be able to get the same level quality information that you can as an in-person exam. What my company's trying to do is to try to digitize the slit lamp exam, because right now the slit lamp is this 100-year-old piece of heavy equipment that sits in an eye doctor's office and it's manually operated. But if you can digitize that and automate it, so now all of a sudden anyone can get a slit lamp exam no matter where they are, you don't even have to have a human on the other side, then you can get way more information than you can with your cell phone. I will say there's a difference between triage and screening and diagnosis, right? So I can look at somebody on the phone, and if they look like they're in a lot of pain, I can triage them into my clinic because they look serious. But I might not know exactly what was going on, whether it was uveitis or post-op inflammation or infection or something terrible like an open globe. But you know, to get to that next level of diagnosis, you do need a lot of information there. And someone did also ask, I'll just add that they asked about Zoom and FaceTime being HIPAA compliant. So during the pandemic, the government relaxed the regulations about what type of communications were possible. And I see that, I don't know how to pronounce it, I'm sorry, Gagan. There is a relaxation of the regulations about which types of tools can be used for communication. So they did allow things like FaceTime and Zoom during the pandemic. And we actually do use Zoom as an institution built into our Epic platform to contact patients, and that is HIPAA compliant.